Invite Dr. Lipi for her presentation on Calotropis induced toxic keratouveitis.
Induced toxic keratouveitis. This is something which is quite common in Chhattisgarh and also, as I know, in northern India. No financial disclosures or conflict of interest. Exposure to the latex of Calotropis, Procera or Gigantea, these are the two common forms. This is associated most commonly with keratopathy in the form of corneal edema and SKs. Ocular manifestations that occur because of two reasons: acidic nature of milky sap and toxins present in the sap. Case report: female patient, 60 years, presented to ophthalmology OPD with complaints of sudden DOV in right eye after rubbing eyes while plucking fudhal flowers. So these are the varied names: fudhar and madar, arc. These are the names given to Calotropis. I had undergone a small incision cataract surgery by resident of our department 3 months back. So this is what compounded the diagnosis a little for the resident. So the right eye vision was counting finger close to face. Anterior segment showed corneal edema, SKs, epithelial defect, hypopyon, pseudophakia. 3 months back only surgery had happened. Left eye 624 because of immature senile cataract, 16 millimeter Hg, and it was quite. This was a pic which was taken one day after the presentation, because on the day of presentation the patient had come after OPD after 2 p.m. and a pic could not be taken. Patient was not cooperative. So this is one day after pic. Hypopyon has reduced a little because the resident did not start on steroids because of epithelial defect, and of course she was feeling it is end off. More of she was feeling it might be end off. But then telephonically I told her to start when I heard about the history. So hypopyon has gone down because of that weak steroids were started. So this is the right eye, big epithelial defect, and this is the left eye. So right eye was treated with topical lubricating eye drop, lotiprednol, tobramycin because of that epithelial defect, and dipenthanol gel, oral vitamin C supportive tablets and medication. Hypopyon reduced and cornea improved after 3 days. This is a pic after 3 days, these two pictures. So fluorescein stain, we can see the epithelial defect has lessened. Hypopyon, it disappeared at 2 weeks. So after 5 days, when epithelial defect improved, lotiprednol antibiotic drop was substituted by prednisolone and gradual improvement. So at 2 weeks, we can see that hypopyon has completely gone. It was a very slow improvement because mostly what I have read in literature, it improves in 2 weeks, 3 weeks, but because there was so much of inflammation, so 3 weeks the picture was something like this, 4 weeks it is slightly improving. At 10 weeks, we are finding a corneal opacity, central corneal decompensation, and corrected vision came to be 6/36, minor correction. The resident had only operated this case, the resident who attended the case. And patient was advised specular microscopy for right eye, which is not there in my Government Medical College, and cataract surgery for left eye. So, quick discussion. Toxic iridocyclitis due to Calotropis has been reported in literature. This could occur if the quantity of sap instilled in the eye is more, or if it was not immediately and thoroughly washed off by the patient. Sap has been found to contain certain substances that may lead to iridocyclitis. This is the pic of that same Calotropis flower, which the attender was obliged, the attender brought after fourth or fifth visit. He brought this flower from his adjacent area from where the patient had plucked it. So to conclude, accidental contact with Calotropis plant may lead to varied forms of ocular toxicity. So this is not only keratopathy, which many of the residents or young ophthalmologists, they think it may be a high-grade inflammation also with hypopyon. So this case seeks mention as uveitis is not a well-known feature of Calotropis latex trauma. Being recently operated, it's 3 months back, hypopyon confounded the diagnosis and required cautious observation. Health education like washing of hands, avoiding contact or rubbing of eyes while plucking of these flowers is important to prevent this kind of injury. These are my Indian references. Thank you.
So all flowers are not safe. The flowers need to be careful about flowers.
Probably,